Mr. President, thank you. Like the speakers before me, I rise today to offer my condolences to the nation of France. As the previous speaker said, she's one of our oldest allies, and people of America stand proud with her during this tragic time. Mr. President, I rise today to share my concerns with the devastating impact of the Affordable Care Act. In specific is the Cadillac Tax. Cadillac Tax is a 40% excise tax set to take place in 2018 on employer-sponsored health insurance plans. In Nevada, 1.3 million workers who have employer-sponsored health insurance plan will be hit by this Cadillac tax. These are public employees in Carson City, service industry workers on the Strip in Las Vegas, small business owners and their retirees across the state of Nevada. My colleagues from across the country have heard the same concerns that I have. This 40% tax will increase costs, significantly reduce benefits, or result in employers getting rid of employer-sponsored health coverage altogether. Mr. President, is this what we want? Is this what we voted for? Is this what the other side voted for? Mr. President, this is precisely why Senator Martin Heinrich of New Mexico and myself have sponsored the Middle Class Health Benefit Tax Repeal Act of 2015, the only bipartisan piece of legislation to fully repeal this onerous tax. My bill has 19 bipartisan co-sponsors, and over the summer, when I committed to taking a leadership role to fully repeal this act, I waited for months for a sign that my colleagues across the aisle would work together to repeal this tax. Boy, there was a lot of tax, Mr. President, but there was no action. And to date, there is still little action from these same colleagues, which is why I asked them once again to join me in repealing this bad tax. This shouldn't be a bipartisan issue, and yet my colleagues across the aisle have turned it into one. That's why I commend Senator Heinrich for joining me in working together in a bipartisan manner to fully repeal this tax. And this repeal needs to happen, and happen quickly, for the employers to be able to plan for the future. Whether it's through our bill or any of the must-pass measures that the Chamber takes up in the next 6 weeks before the end of this year, for example, tax extenders, the Cadillac tax needs to be fully repealed. As a member of the Senate Finance Committee, this is something that I've engaged my colleagues on and will continue to do so, especially as we hopefully look to move tax extenders before the end of this year. This is not just something that needs more bipartisan support in the Senate. There are over 218 co-sponsors in the House of Representatives. Nearly half of them are Democrats. And 83 organizations have endorsed our efforts to repeal the Cadillac tax. It's very rare these days to see this much agreement in Washington, D.C. Organized labor, chambers of commerce, local and state governments, large and small businesses have come together with a bipartisan group, putting forth a solution to fix a problem affecting so many hardworking, tax-paying Americans. The Cadillac tax doesn't officially go into effect until 2018, but the impact of this tax is being talked about more and more because employers are starting to make major changes now, to their workers' health benefits in order to limit the impact of the tax or avoid the tax altogether. I've heard from large companies. I've heard from small businesses, organized labor, such as the Culinary Union in Nevada, and they're all saying the same thing. And I'll quote, "The Cadillac tax needs to be fully repealed, or our employees will experience massive changes to their health care," unquote. We're talking about three things here, Mr. President. We're talking about reduced benefits, we're talking about increased premiums, we're talking about higher deductibles. Is this what we want? All of these lead to more money being taken out of the pockets of hardworking, tax-paying families. According to the nonpartisan Kaiser Family Foundation, employees who have job-based insurance have witnessed their out-of-pocket expenses climb from $900 in 2010 to $1,300 in 2015 on average. That is almost a 50% increase in the last 5 years of their insurance coverage. Employees working for small businesses now have deductibles over $1,800. Kaiser also notes that deductibles have risen nearly 7 times faster, Mr. President, 7 times faster than workers' earnings since 2010. Kaiser's president, Drew Altman, said, and I quote, "It's quite a revolution. When deductibles are rising 7 times faster than wages, it means that people can't pay their rent, they can't buy their gas, and they can't eat," unquote. As deductibles rise, another way employers are planning on avoiding Obamacare's massive new tax is by eliminating health savings accounts and flexible spending accounts. Over 33 million Americans use FSAs, or flexible spending accounts, and 13.5 million Americans use health savings accounts, or HSAs. And they may see these accounts vanish in the coming year as the companies scramble to avoid the law's 40% tax hike. HSAs and FSAs are used for things like hospital and maternity services. They're used for child care. They're used for dental care, physical therapy, and access to mental health services. Access to these life-saving services could all be gone for tens of millions of Americans if the Cadillac tax is not fully repealed. Every day there's a new article in the national press talking about how middle-class workers, tax-paying Americans, are going to be hit by this tax. Towers Watson, a management and consulting firm, did a survey of large businesses who typically offer the most comprehensive coverage. They found that in 2018, more than half of the employers are planning to significantly cut what they contribute to insure employees' spouses and children. The United Parcel Service, UPS, is one of those companies that has already said they plan on limiting plan eligibility for spouses of employees. Sean O'Brien, Assistant Policy Director at the AFL-CIO, said recently that employers are coming to the table asking for cuts in benefits based on their preliminary projections around the 40% excise tax. To make matters worse, Chief Financial Officer of a waste and recycling company, Action Environmental, recently told the Wall Street Journal that his company would consider getting rid of its employer coverage altogether because of Obamacare's Cadillac tax. And he said, and I quote, "I'd be lying if I said we haven't already had that discussion," unquote. Delta Airlines expects Obamacare will cost it $100 million per year. One reason for the new cost is the 40% excise tax on Delta's employee health benefits. As if Americans don't already have enough issues with airlines these days. And out of all the news we see from the Cadillac tax, none of it, zero, is positive. The goal of health care reform should be to help those who do not have health coverage and lower costs for those who already have insurance. This tax doesn't achieve either of these goals, and everyone knows it. I will do everything I can to see that this tax is fully repealed. This is a real urgency that we get this done. And I will work with anybody in this chamber to see that the Cadillac tax is fully repealed by the end of the year. And once again, whether it's my bipartisan bill or in a year-end package like tax extenders, we need to repeal this very bad tax. Fully repealing the Cadillac tax is an opportunity for Republicans and Democrats to join forces, work together to repeal a bad tax for one purpose, and that is to help 151 million workers keep the health care insurance that they like. Thank you, Mr. President.